Good morning. Good morning. Is this mic on? Yes, it is. Okay. So I need everybody to grab their croissants and reclaim your seat, if you would. And we're going to get going with the home stretch of the conference. We're trying to wrap things up roughly around noon, so if you could please take your seats, that would be a big help. I'm Mitch Shannon. It's my pleasure to resume this session this morning with two, I would say, eminent healthcare professionals. We have Dr. Shafiq Qadri. He is the medical doctor, writer, and MPP. He's an old friend of this conference. And Dr. George Friedman. George is a DDS, and he's highly qualified to assist if you happen to break a tooth on a croissant this morning. He's standing by. George is new to the Pharma Congress, but he's been rehearsing for 30 years, giving CE talks around the world. I guess healthcare providers are, by definition, very busy people, but these two, I think, are leading a kind of a combined 47 lives if you look at their CVs in the conference binder. And actually, I should mention Shafiq has added to his CV. He's now officially a novelist, and you can have a look at his novel on Amazon.com. $4.95, I'm told, for a download if you happen to have a Kindle. Shameless plug. Okay. What you're seeing right now in that table is kind of evidence of the declining influence of physicians as influencers in the drug selection process. This is actually an old graph. I think it dates back about 6 years. And through that time, they were predicting that by 2012, the influence or the relative influence of physicians would decline by about 60%. Here we are in 2013, and I think it's IMS data, or IMS Brogan as they are now, and they could not have foreseen things like enhanced pharmacists or M-Health or any of the new trends that are going to continue. They're prescient, but they're not clairvoyant. But I think if you sort of follow the trend, you start with physicians being the key influencers, and you're down to where they're at a much lower level. If this trend continues in a straight line, by 2016, physicians are going to have less influence, I would predict, than Walmart greeters or lottery kiosk employees or TTC ticket takers. And I think a fair question is, why is this? And part of it comes down to a couple of interrelated points which the two professionals are going to address. And then I don't think we're going to have a chance to talk about this because we are running a bit late, but you can certainly continue the conversation at lunch today. To summarize briefly, I think the decline of physician influence is a story about transparency, technology, and certainly there's no getting around it in money. Under the transparency rubric, I guess in the last few years, industry and doctors have learned quite a bit about each other, as has the rest of the planet. We now have websites that lay everything bare. You have ratemds.com, you have that Angie's List in the United States where physicians are subject to review by their patients. The patients can tend to be quite frank, which sometimes eyebrow-raising. And at the same time, we have quite a few jurisdictions in the United States that now require reporting of any consideration that's exchanged between industry and a physician. And this too is on the web. So you have this ProPublica website, which is the one on the right there, which actually indicated there's a number of mainly psychiatrists in the United States who have received more than $1 million in speaking fees and other kinds of ad board fees from US companies in the past several years. Certainly does raise eyebrows. Now, this is kind of the neat thing, technology, which I guess, year after year we come to this conference and more than once somebody said, where's the disruptive technology? We've seen it in the IT sector, we've seen it in banking. Where's the thing that's going to disrupt medicine as we know it? And I think we're looking at it. Possibly. I mean, it may not pan out as advertised, but I'm not going to do the touchpad thing, but show of hands, who knows anything about 3D printing? Okay, cool. So 3D printing is popping up, not so much in North America, but third world Africa. This is pretty much exactly what it sounds like. You can use a laser printer to create a solid object. They're making shoes in Africa for people who don't have them, and it's an inexpensive way to do things. Well, now they've kind of gone beyond. This is an article that was just published online, research out of Oxford University, published in Science magazine, current issue. If you're curious and you can't wait, use your iPhone to scan that QR code. It'll bring the article up. But the gizmo that you see on the left is a 3D printer, and that gooey thing on the top, and that's the code. If you want to make note of that, you can check the article later. Okay, well, that's a time-lapse photograph of something coming out of a 3D printer, and what it is the equivalent of human tissue. There it goes. So you sort of have to pause for a minute and think about that. The equivalent of human tissue. So the article, which I urge you to read, it's from a young guy who works in a lab with Professor Hagen Bailey. He is the head of the chemistry department. Student's name is Gabriel Viller, and that's one of those names you might want to take note of because it sounds like he may be the next Steve Jobs or Bill Gates. He's successfully using 3D printing to create what is essentially living human tissue. So again, you sort of need to think, interesting, what exactly does that mean to me? Well, I think it has tremendous implications for drug development, for drug manufacture, for drug delivery, and on and on. It could well be that this goes nowhere, but among the early things that people are thinking about this is this could be the replication of body parts, organs, in George's case, teeth, I guess, but it's all part and parcel of the same thing. Disruptive, yes, if this follows its promise, it certainly would be. And it introduces lots of questions. Would it be more cost-effective to print out a new kidney for somebody than pay for cancer drugs? Remains to be seen. Who makes the determination? And ultimately, who writes the check? So I think we're entering some really uncharted territory here. And yep, there's the animation. It's micro thingies that are coming out and forming tissue. Okay, so a question for you, and then I'll let our doctors take over. And that question is, will coming healthcare technologies cause industry, doctors, and other stakeholders to work more closely together, or will it drive them further apart? Vote A for closer, B for further apart. A very optimistic view of things, and I would like to believe that. I think I do believe it. And with that, George, you're up.